would be the problem I had. Interestingly enough, my wife did a lot of research, and she came upon TMJ online and said, I think this is what you have. I think you have this. As I laid in bed, she brought a laptop over to me, and we read through symptoms. She got online and found Dr. Don's website. Just so happens that Dr. Don is my child's dentist. We set up an appointment, and to be very frank, I was quite skeptical. Nothing I had done in the past really amounted to any kind of relief for me. She put me through a banquet of tests, listening to my jaw, getting rotating x-rays, some serious work to really see and determine whether she could help me or not. And that was probably the most interesting thing to me, was there was no guarantees that this is what I had. She really investigated to see if she could help me, if this was an avenue, where most people I had gone to immediately assumed they could help me, and that whatever I had, they could cure with a quick pill. That wasn't the case here. And we did discover that I had some problems in the alignment of my jaw and where my teeth were sitting at. She took a couple of tongue depressors and literally put them in my mouth. And after I did that, I felt relief. Not complete relief, but I felt a change immediately. And I knew we were onto something.
Well, instead of having him walk around with tongue blades in his mouth, we make a very specific appliance that he wears on his lower arch, kind of like a retainer. We call it an orthotic or a splint, that repositions his jaw in a position that allows for healing, allows for the nerves and blood vessels in the back of the jaw joint to heal and not be compressed and causing all the headaches and neck aches that he was having. So now he's progressed through orthodontics, and through orthodontics we are putting his teeth in the position that that appliance put his jaw in, so that he has a permanent solution.
The fabulous part here is that I have a solution, and we have started moving my teeth. My appliance that I wear is getting smaller and smaller, so I'm seeing progress in that, in its physicalness. But in myself, I don't have headaches anymore. I don't have stomach problems anymore. I don't have sleeping problems anymore. In fact, I'm probably the most physically fit I've been in 20 years. The interesting thing also is that I'm not on pain meds. I haven't been on pain meds since a week after I started. And you really can't argue with results.
All right, Dr. Slabach. Now, as we've talked to your patients today, and as we continue to go through stuff, we keep coming back to diagnostics and technology. Now, when I talked to you on the phone, you repeatedly talked about being able to diagnose people to find out what they really had. And I thought that was a little strange, because I thought every doctor did that. After talking to your patients today, I'm starting to realize maybe that isn't true. So tell me a little bit about how big a role technology plays in your practice, and then, of course, tell me a little bit about this.
Well, technology plays a huge role, because we're way beyond the mouth at this point. When we're dealing with jaw joint issues, sleep issues, we're not just looking at a tooth and a mouth. We need to see what's going on in the whole head and neck region. And yet we don't want to be poking and prodding in the mouth, in muscles, in joints, right, what have you. So this gives us a three-dimensional view with various x-rays that we take.
And this is called
this is a Panoramic CMT, okay, complex motion tomography. We take about 8 different films on here, several views of the jaw joint, views of the sinuses, a couple different skull views. We take a view of the cervical spine, because
all
we are looking
machine.
All with this machine, and all in a very relatively short period of time.
Okay, and that allows you to diagnose better? I mean, I spend my life in dental offices on a variety of subjects. I don't see very many of these in offices. So if I was to get treated for something, sleep, jaw joint problems, would this be something I would want to make sure somebody had?
Absolutely, absolutely. We can't a standard dental x-ray, dental panorex x-ray does not show us diagnostically what's going on in the skull and the jaw joint, the head and neck region at all.
Well, because one of your patients today said that they had been to wasn't a dentist, it was another form of doctor, ear, nose, and throat doctor, who basically looked at them and said that they were going to try to make them an appliance like you make, that they hadn't done very many, but they were going to try. Can anybody really make an appliance? I mean, how really important is the diagnostic part of the whole thing?
Well, anybody can make an appliance, but you're guessing on jaw position, you're guessing on what's going on in the jaw joint, you're guessing on what's going on in the bones of the skull and the neck. And what I need to do is I need to make sure that I'm going to be putting somebody's head, neck, the muscles in balance. And I need to be able to see beyond the skin, beyond the tooth.
This is a strange time for this question, but I watch how you talk about you. Do you think being a female makes you more, I don't know, I hate to use the word motherly, but moms always want to make sure they know everything that's wrong, and dad chooses just makes a decision. Do you think that being a female helps you listen and to learn more, and does that drive you towards this diagnostic part of your practice?
Yes. I mean, I think being a female, I do tend to listen more. I am a mom, and I do think that I do listen a lot. I listen to what my patients say. They have adequate opportunity for as many hours as they want.
So I'm a dance teacher, and I teach Dr. Dom's daughters. And we were at the studio one day, and I was complaining about pain in my jaw. And she says, well, you have TMJ. And I said, no, I have pain in my jaw, and it hurts, and it clicks. And she said, come and see me. And I had never heard of it before. So I came to the office, and she did some x-rays, and she said, absolutely, that's what it is. So she made the appliance for me. And just like that, the headaches that I was having was gone. The pain in the jaw was gone because I was so out of alignment that the appliance brought it all back in, and it's been a godsend.
Okay, you're going to show me what a JVA actually is and how it works.
Yes. I've got David all set up for joint vibration analysis. It's also called JVA for short. We know that joints that are functioning smoothly should not make vibrations, should not make any noise, shouldn't be any friction in the joint.
They should just be liquid.
Nice and smooth.
Right.
This technology is similar to a seismograph that measures vibrations of the earth during and before an earthquake.
Okay.
Same kind of technology here. We're
So
picking up those kind of
the joint
vibrations.
should be no vibration.
Right, absolutely.
All right, well,
Totally
show me how
okay.
this works.
These are microphones sitting on his jaw joints.
Okay.
And David, I'm going to ask you to open and close rhythmically. I'll say open, close down to your teeth tap. Okay. If you feel any clicking, popping in your joints, I want you to make sure that the computer hears that. Don't stop short of that.
Okay.
Okay?
Okay.
Open, close, open, close, open, close, open, close. Great. Super.
And that's pretty much it. You're listening for vibrations.
The computer is. When Lisa first came to me, she had her husband with her. The doubting husbands, as I call them, and she was doubting as well. But by the time she'd been to all these doctors, she was, as she told you, losing hope. Lisa had, a malpositioned jaw. She had compression of blood vessels and nerves in the back of her jaw joint that were causing her headaches, neck aches, shoulder pain. And we took her through all of our normal diagnostic procedures to definitively come to a diagnosis that she does indeed have a TMJ disorder.
It wasn't an immediate change. In fact, she told me, you will hate me for the first few weeks. Because when you position the jaw in a neutral position, your muscles are so tight, they have to learn to relax and go back to that position. But after that first few weeks, I had a significant improvement, and it has continued to improve. I'm about 70–75% better than when I first came to see her. Let me put that into perspective. That's like 25 to 30 days of headaches a month when I first came to see her. After, right now, in the position I am now, it's about 7. I've got my life back, and it's continuing to improve.
All right. Now, you also treat sleep.
Yes.
You said a lot of times people with TMJ have sleep problems. What do you use to diagnose breathing problems with people?
We use technology called the rhinometer pharyngometer.
Okay.
It's acoustic reflection, similar to a fish finder, only we're not looking for fish.
Right.
We're sending sound waves through the airway, having them echo